In today's health alert, as winter illnesses spike, some hospitals and healthcare facilities adjusting visitor guidelines. That includes Detroit Medical Hospital. Today we learned no visitors 12 and under are allowed on the inpatient floors or observation units. Visitors older than 13 who are not feeling well urged to stay home. This applies to all DMC hospitals, and to help us better understand the reasons behind these changes, our health editor, Dr. Partha Nandi, here with us again. And we want to ask, why are these changes so necessary?
Important question, right? So in just 3 weeks' time, flu cases in Michigan have jumped from 570 per week to 2,706. Also, RSV, respiratory syncytial virus, has doubled from 271 to 550 cases. And that's according to the latest report from the Michigan Disease Surveillance System. So more folks are getting sick and seeking medical care. Now, we know how important love and support is, right, for healing people when they're in the hospital or receiving care. And that's why hospitals only implement new restrictions when it's absolutely necessary. The main reason behind these changes, in my opinion, is to limit the spread of highly contagious viruses like flu and RSV, especially in places where at-risk populations are concentrated. For patients who are immunocompromised, elderly, or dealing with chronic conditions, even a mild infection can pose serious health risk. By taking precautions like limiting the number of visitors, not allowing kids under 12 and asking sick visitors to stay home, well, hospitals can reduce the spread of these illnesses and prevent outbreaks. Now, this also helps protect medical staff like us and keeps critical resources like ICU beds available during this peak illness season.
That brings us to another question. What about masking? When should people be masking up?
Yeah, a lot of people ask me that. So I often mask, especially when I see patients. Now, masks can be very helpful. And when can they be helpful? First, when there's a lot of diseases, illnesses spreading in your area, like now. If you've recently been exposed to a virus, feel sick or recovering, or if you or someone around you is at high risk for severe illness. The reason why masks help is this, because they act like a filter. They help protect you from breathing infectious particles or germs from others. Now, if you're sick, a mask helps protect those around you. It's super important to know that all masks are not the same, and they offer different levels of protection. Their effectiveness can vary depending on the type and size of the virus. Well-fitted masks like N95 or KN95s provide the best protection. They're especially effective if worn correctly, covering your nose and mouth, and not those folks who cover their beard with it, right? In my opinion, if you're sick or experiencing symptoms, I'd recommend staying home instead of wearing a mask and going out. It's the same. It's best to keep others safe, especially vulnerable and family members and friends. If you need to visit a hospital, please check the visitor policy ahead of time so there's no surprise. And remember, taking simple precautions can go a long way in protecting our hospitals and communities. Speaking of protection, it's still not too late to get vaccinated. I know it's a broken record, but vaccines like the flu shot and COVID boosters take about 2 weeks to kick in, so they can still help keep you safe and others safe in your community. It's not always about you, it's about those folks that can die from these illnesses.
Yeah, years later, we're still talking about vaccines, but that's because they're important.
Exactly. And then also people spread misinformation. Just listen to your doctor and get the right ones that you need.
Yeah, don't do your research online. Thanks.
Exactly.
Thanks so much.
My pleasure.
And this week on the Dr. Nandi Show, join Dr. Nandi as he explores the mysteries of the afterlife. Renowned neurosurgeon Dr. Eben Alexander sharing his transformative near-death experience after a severe brain infection left him in a week-long coma, turning him from skeptic to spiritual believer. Tune in this Sunday, January 12th at 5 p.m.